Macular degeneration. What is that?
So yes, sir, you mentioned age-related problems, right? So this is, the actual name is age-related macular degeneration.
Where is the macula and how does it degenerate?
So great question. So the macula is the center part of the retina. So the retina is the inside lining of the eye.
It's in the back of the eye on the inside?
Exactly. It's in the inside of the eye, and that's what all the light gets focused onto the retina. So the macula is like the bullseye of vision on the retina. About 90% of our vision actually takes place in the macula.
So it's a terribly important part, and that's what we see when we look out is the main part, the tunnel part of the vision.
Yes.
So macular degeneration, what does it look like when you look in somebody's eyes, and what are the symptoms?
So the main symptoms would be blurriness, at an early stage blurriness. When macular degeneration gets advanced, it can actually cause a complete blind spot in the center part of the vision, which can be very debilitating.
Can you see your peripheral vision? Is it okay?
You can.
It's just, so if I'm reading a book and I see that I can't see those words unless I try and move over, and that doesn't. Can you read that way?
Most people with really advanced macular degeneration are functionally blind. So they can get around. They're not going to be bumping into walls because they do have that peripheral vision, like you mentioned. But for example, if I were looking at you and I had terrible macular degeneration, I might see everything but not be able to see your face.
So I would be that'd be pretty good if I was blurred and you could see around. So what does the patient gets blurred in their central vision, and when you look at the eye, what does the macula look like, healthy and not healthy?
So in a healthy macula, there's a very uniform pigment distribution in the back of the eye. So at the early stage of macular degeneration, we might see a little granularity, a little irregularity in the pigment pattern. And usually, if we start to see that, we'll make some general recommendations for people, for things that they can do to try to reduce their risk for that macular degeneration getting worse.